So let's move on to the next debate. It's on brown cataract, SICS versus Phaco versus FLACS. So I'd like to invite Dr. Jagannath BORAMANI, sir. He's a pioneer in SICS, and he also has done a lot of work on managing astigmatism with SICS. So let's see what he has to say.
Yeah, thank you, Dr. Anga, for inviting me here. But you didn't tell me, when you called me, you are going to talk on brown cataract. I was very happy. And you didn't tell me who was my opponent. Fortunately or unfortunately, my opponent turned out to be my mentor and teacher in Phaco emulsification, the Bhishma Pitamaha of Phaco emulsification, who has held my hands and taught me Phaco emulsification. So I'm literally having feeling like Arjuna on Kurukshetra. But everything is fair in love and war. So let me start. I have gone through the literature search. All the papers say that Phaco emulsification and SICS gives equivalent result. Most of the papers are saying, some papers are saying that the central corneal thickness increases after the Phaco emulsification. It doesn't increase with SICS. SICS is more useful for intumescent and hard cataracts, and generally, as far as the economics is concerned, SICS is useful for our Indian scenario and the common man. In the previous debate also, Dr. Anga was telling about think of common man, think of common man. So let us think of common man. The FLACS option, even if hypothetically, if all of us are convinced that FLACS is the surgery for brown cataract, I don't know how many of you are going to buy and book a FLACS, the femto machine, within say 6 months here afterwards. And the most important thing is that SICS is eco-friendly. The carbon footprint is very high in Phaco and FLACS. Only problem is that all the published literature says that what about astigmatism, because SICS, as per the published literature, increases the astigmatism induced is little higher. But that also is not true if you learn an advanced SICS. I can show you few cases wherein I have done brown cataract multifocal lenses and astigmatism is not induced at all. There are so many cases, 0.33, no change. This is a case 0.44, it has been brought down to 0.07. And even if in cases of higher astigmatism, this is a case of high astigmatism, couldn't afford toric lens, still I have brought it down only with SICS and only with the scleral incisions. So I am putting the multifocals and all these autofocus lenses with more confidence because I know how my astigmatism is going to be controlled. This is a doctor patient who wanted multifocal without toric. With multifocal I brought down his astigmatism. Now how this is achieved, the principle is very simple. You know that if you make the incision from curved, the astigmatism is reduced. But why not make it more and more curved if you want to induce very less astigmatism? So I am promoting this as a premium surgery. My data has been gone to IJO and most probably it will be published, hopefully. So I publish SICS as a premium surgery with or without premium lenses. My SICS packages are higher than the Phaco surgeon charges surrounding me. And mind you, even if we should not talk about the finances in academic session, the highest package for cataract in India is for a monofocal lens with SICS, and that is 2 lakh, which is going to be 3 lakhs in very near future. So now the question is, in all the conferences you have already heard, when to convert to SICS in difficult Phaco, when to convert. Have you heard any talk? Mostly not. When to convert to Phaco in case of a difficult SICS? Keep thinking. There is no such talk. This means that SICS is for all soft and hard, white or brown, rich and poor. It is for rural, urban, beginners and everyone. Learn advanced SICS and promote it as a premium surgery. Instead of paying to the companies, you earn yourself. So do premium surgery, earn well and sleep well. Thank you very much.